Well, they may have come hoping for Beyonce, but they left with COVID. Reports are rolling in of positive COVID tests out of the DNC this week. Reporters and attendees have been posting test results after a convention with 20,000 people packed in, and that includes members of Kamala Harris's own staff, with sources close to the campaign telling NBC News the developments could affect staffing at events this week. It's all part of a summer COVID wave and new concerns about the virus as kids go back to school. The rate of hospitalizations, for example, nearly twice what it was this time last summer. Here to talk about it, MSNBC medical contributor Dr. Kavita Patel. I'm happy to say I haven't seen you in a while, but here we go again, doctor. You were also at the DNC. You know a lot of people, right, who got sick. Is this just the new normal, 5 summers into COVID?
Well, Chris, I hate to say it, but it does seem like the new normal. I would like to just add that there were many of those same people where I said, hey, I'm not going to get into that packed bus or into these settings, even with a mask, because I just had from what I knew about the patients I've been seeing, we're going to see a lot of COVID. And sure enough, if there is any good news to be had, it's that in general, the cases are incredibly mild and the symptoms are incredibly mild. That doesn't hold true for everybody. We still see hospitalizations. I'm sure somebody, just given the statistics, Chris, from the DNC is going to have to go to the hospital, unfortunately. And that's where we get into this shift. This is a new normal. But could some of this have been prevented? Could we have taken measures so that it didn't have to be this bad?
Yeah, so I guess let's start with what we can do. There's a new COVID booster out there.
Right.
Who should get it?
Yeah. So this is a great question. Because of so many people recently getting COVID, that if you're generally healthy and you've recently gotten COVID, like in the last 3 months, Chris, I've been telling people to wait. And how long do you wait? It depends on when you had COVID. And again, ensuring that you're overall healthy, that you can wait several months to get that booster. And it's just one shot, no need to have had other shots before, one shot and you're done, no matter what age. And that way you can make sure that you're protected for the next wave. I'd like to tell you, I know when the next wave is going to happen, but it'll be around winter time, we expect. So if you have not recently had COVID, knock on wood, Chris, I'm in that group. I have not had COVID yet. So I'm probably going to go out and get it. Why?
Never
because I'm
had
around
COVID?
a lot of people. I hear you're I have not. I know everybody will write to me and say, oh, I'm sure you have. But it's hard to believe. Might be a comment about the things I'm doing to prevent getting COVID, but I'm not perfect. I just happen to be one of those people. I'm going to go ahead and get this shot as soon as it's available, which is now. I've got my appointment for next week so that I can get it. I'm going to also try to see if I can get my flu shot. I also want to remind people the federal government is going to be making tests free again by the end of September. COVIDtest.gov. It's not free yet, but I want people to make sure they've got the tests in hand. The vaccine is available now. And then don't forget about Paxlovid and other medications, Chris, in case you do get COVID. That's a lot of what I've been telling people who've been getting positive tests from the DNC and in the community. Make sure you get treatment if you qualify.
If symptoms are mild, what should people be looking for? For example, I came back from the DNC tired. No.
Yeah. Right.
So what?
Right.
And so what to look for, and any tips for parents
Right.
as kids go back to school?
Oh, I love these questions. Yes. Being tired can be a symptom. It can be totally normal, just like I suspect I tested. I was tired. But being tired can sometimes be that first sign. Generally, what we're seeing, though, Chris, is cold symptoms, sore throat, that scratchy sore throat that you're like, hey, I generally get this when I get a mild cold, or that little sniffle, runny nose. Those are generally the preponderance of symptoms I'm seeing. I haven't seen someone say I'm just tired and I had no other symptoms. Everyone is showing with those symptoms. And then if you've got children and you're going back to school, you want to keep them healthy. So you want to test them as well. It's easy to give and get COVID inside of a household. Remember that if you have it, you can wear a mask and wash your hands so that your kids and other people don't get it either. But teach the kids to sneeze and cough in their elbows, Chris. That can go a long way, and washing hands, too.
All right, Dr. Kavita Patel, it is good to see you. I just always wish it was under better circumstances, and I still can't believe you did get COVID. Good for you.